Hello and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. More than 17,000 recoveries in Lagos State, crashing the number of active cases in the country to less than 3,000. Ogun State government invites the unvaccinated to take advantage of over 300,000 Johnson & Johnson vaccines just received. And World Health Organization hosts third Global COVID-19 Research and Innovation Forum. The European Medicines Agency has approved Moderna's COVID jab for children aged 6 to 11. The EMA's Human Medicines Committee has recommended granting the extension indication for the COVID-19 vaccine Spikevax to include use in children aged 6 to 11. The vaccine, developed by US-based pharmaceutical company Moderna, has already been approved for adults and children aged 12 and above. According to the EMA, as in the older age group, the vaccine is given as 2 injections in the muscles of the upper arm 4 weeks apart. Meanwhile, in Nigeria, new cases were recorded in 3 states, Rivers, Lagos and Abia. The agency's report also includes over 17,000 community discharges from Lagos State and a backlog of discharges from the state from December 2021 to date. Here's more on the pandemic update.
34 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 3 states and indicate a drop from the figures reported earlier. Rivers had the most cases with 15 reported infections, followed by Lagos, which had 14 cases. Abia reported 5 new infections. Nigeria now has a cumulative caseload of 254,428. No cases were reported from 2 states, Delta and Sokoto. 17,989 patients have been discharged from communities, increasing the total number of recoveries to 248,850. This number includes a backlog of recovered persons in Lagos from December 2021 till date. There were no additional deaths recorded in the last 24 hours, leaving the fatality toll at 3,142. The number of active cases in Nigeria has dropped sharply to 2,451, and more than 4.3 million samples have been tested so far. Benue State accounts for the highest number of cases on admission with 340 active infections, followed by Kwara and Nasarawa states. Lagos now has only 3 active cases. More than 17 million Nigerians of eligible age, representing 15.6% of the target population, have received 1 dose of the COVID-19 vaccine, while more than 7.8 million of the population, representing 7.1%, are fully vaccinated. In Africa, over 11 million persons have tested positive, while over 247,000 deaths have been recorded across countries on the continent. Globally, the total number of confirmed cases has surpassed 431 million, while deaths are beyond 5.9 million.
And to Ogun State, where the government says it has taken delivery of about 375,000 doses of the Johnson & Johnson vaccine, with high considerations for hard-to-reach areas of the state. The State Commissioner for Health, Dr. Tomi Koka, gave the figure during a press conference held at the State Ministry of Health in the state capital, while asking residents to take responsibility for their health in order for the state to achieve its 70% target. She assured residents that vaccines are readily available at all primary health care centres across the 21 local government areas and other designated places.
We have been able to vaccinate 576,327 and 382,947 people respectively, making a total of 959,274 vaccinated individuals in the last 4 months. This really covers about 80% of the people that have been vaccinated since March last year. In order to reach more people, The single-dose Johnson & Johnson COVID-19 vaccine has been introduced by the federal government of Nigeria to cater for the hard-to-reach, the underserved population of the nation. Ogun State has received 374,700 doses, which will be available across all 20 local governments. However, priority will be given to local governments where there are security challenges and where there is challenging terrains. For those who have not been vaccinated, either from fear of multiple doses, we now have a single dose vaccine. So please present yourself at all our vaccination sites, and our staff will be there to vaccinate you.
Dr. Jamiu Ganio is a public health physician, and he joins us now for more on the vaccination ongoing in the country. Thank you for joining us on the program.
Thank you very much. You're welcome.
Welcome. I'd like to begin. Last year, the scale strategy was launched: service delivery, communication, accountability, logistics. This is to increase the number of vaccination sites to reach more Nigerians with the COVID-19 vaccine. How will you say Nigeria has fared with reference to the scale strategy?
Well, I would say so, not too impressive. Considering the fact that as at January, it was expected that we'll have vaccinated about 50% of the eligible. But you can see, based on the data, it shows that we are yet to get there at all. We still have a long way to go as regards to ensuring that we achieve meaningful vaccination coverage. We've not really done the data has not reflected the fact that we've really done very well so far. So there's still room for improvement. That's what I can say for now. Yeah.
Now, do you think what the country needs now is more sites, more vaccination centres, or more sensitization to reduce hesitancy? And this is when you look at our speed of vaccination.
I think what we need now is issue of more sensitization, trying to create more demand. Because it's like the government have done very well as regards to scale up of sites for vaccination, but it's like the issue of hesitancy has continued to persist. And apart from that, as I've said in previous interview, we need to look at it that a kind of local challenge regarding the coverage. There is total disparity in terms of coverage when you look at the 36 states and FCT. Where some people have achieved more than 30%, some states are battling with 1% or less than that. So I think, as I've said, it is high time maybe the appropriate government, make a review of our vaccination strategies and see the gaps and try to see how we can improve on those areas we feel that we need to improve upon. But as I've said, just like you said again, there is need to create more awareness. That confidence must be a kind of a guarantee among the citizens so that we can create more demand so that people can actually go for vaccination. Thank you.
Last week, the WHO selected the first 6 African countries that will receive the technology needed to produce mRNA vaccines on the continent. Should we be concerned about the resources to deliver on the manufacturing of the vaccines?
Well, there's no concern as regards to that. As I've said, this is not new. Nigeria has been a hub for production of yellow fever vaccine in the past. So there's nothing new, and I can tell you that we have the structure on ground. We have our appropriate research institute, and NAFDAC is doing a fantastic job as regards to getting accreditation for us to commence vaccine production. And one thing we need to understand is that the production is not only made for COVID-19 virus, it is also will serve as an opportunity to produce other vaccines, just like it has been mentioned by WHO. Currently, we are in the point of achieving vaccination for HIV/AIDS, could also be an opportunity for us to develop to start producing vaccine for TB and other diseases. And it's an indirect way of creating investment on health and creating more revenue for the country if in the event we're able to achieve that landmark. But I don't believe that we don't have such resources. We have. It's just for us to, try to provide necessary support. Government provide necessary support, logistics. In terms of woman capacity, I don't think we're having challenge in regards to that. And also, it is a case of like borrow technology, a kind of partnership and collaboration. And I think by so doing, I think the government, if we can achieve that, we can key into that, it will really, help in making Nigeria a kind of vaccine hub for other countries to also make purchase and make procurement from. And that may help in, boosting our GDP and our economy. Thank you.
And Dr. Ganio, we approach, 2 years since our index case was discovered in the country, so 2 years of COVID-19. How would you assess its impact? And this is on health workers.
Well, you know, it's not only on network, but on health workers, I think you believe me doing that with that issue, we recorded mortality, we recorded morbidity. There was series of strike for better wages, better welfare, and so on. And I think we'll be able to pick up from there. It is no longer new. Everybody, the level of consciousness is high, the level of awareness is high. It's just that in one way or the other, we are still faced with some challenges or maybe personal protective equipment. But I think in the long run, we've really done very well. It is the issue of COVID-19 is no longer new, and we are blessed with the fact that we are only having mild to moderate cases, only in occasional cases that we tend to witness some severe cases, and it is being reflected on our mortality data. It is not too high and so on. I think we've done very well. The level of awareness is high. The level of keeping with infection prevention and control is high among the health workers. And you know, the same health workers have also been involved in terms of surveillance, case management, and other logistics support that has helped in putting the pandemic to a control level in the country. Thank you.
And we have, health workers. We also have frontline workers in the mix. But then, looking at how things have progressed so far, what do you think we have learned? And are we better prepared if there were to be another pandemic?
Well, I will tell you, the issue of preparedness is not only restricted to Nigeria. You find that even the best advanced country where we thought, especially in China, where the virus actually originated, we were surprised to see that they were overwhelmed at a particular time. So we keep on, the lesson learned is that we keep on a kind of improving on the existing structure, on existing preparedness. We keep on improving, and by so doing, I think we can be able to respond to future pandemic. But no amount of preparedness that can be enough. There is no standard that regards to that we can say can help to a kind of curtail any epidemic or pandemic. The only thing we try as much as possible to ensure that we try our best. But I can tell you that we've improved from where we are, where we had Ebola epidemic in the country. We now have a lot of people being trained. With our surveillance system is high, our data reporting has improved, and many other things. The level of our education, infection prevention and control has also improved. The only thing is that what we have learned is that, especially as regards to vaccine, the issue of the so-called global solidarity was not really, was not achievable, in the sense that you could see how the most advantaged countries were holding vaccines and so on, leaving other poor countries at their own, level. That is leaving them, to just a kind of, take it and be at their own.
More like on their own.
One thing I would say is that, yeah, so we've really, in terms of preparedness, I think we've done very well, and you could see the kind of commendation we've received from WHO. But as regards to vaccine, I think it would be a good opportunity if Nigeria start producing our own vaccine, not only for COVID-19, but have a kind of structure on ground that will ensure that we start producing other kind of vaccines, so that, especially, we are still being challenged by Lassa fever. So I think if in the event we're able to start producing vaccine, it will produce another opportunity to start producing vaccines such as Lassa fever, so that in the long run, we can nip the outbreak of Lassa fever, which has been a major challenge seasonally in the board. So that is what I can say for now.
We appreciate your time, public health physician, Dr. Jamiu Ganeo. Thank you for joining us today.
Thank you. Thank you.
We've got a break now. When we return, Germany's health minister is warning that the COVID-19 pandemic is not yet over. Find out more about what he says when we return. Welcome back. Staying in Nigeria, the COVID-19 pandemic has hurt the performance of students in Jigawa State. The Permanent Secretary, Ministry of Education, Safiya Mohammed, disclosed this to Channels Television in Dutse, the capital. According to her, the state government introduced a radio program to assist students studying from home, especially during the lockdown.
Yeah, it did, but partially. Being that during the COVID-19, Jigawa was proactive by introducing radio programs. And the radio programs were run in a way that students would participate. And what I mean is that it was aired on the radio, and the students, learners, were given the chance to phone in. Let's say the program today is taking place, then the students are asked to take questions. Then the next day, that presenter will not answer the questions taken. So it's a kind of, there wasn't any disruption much. It was minimal because we engaged in the radio programs, so they had the access to ask questions, and the questions were answered. And sometimes even some of the facilitators on the radio program even give out questions. Say, okay, we want you to solve this, and give us feedback in the next program. So actually it wasn't so much, but definitely there was some kind of setback, but it was addressed.
The World Health Organization is hosting the third COVID-19 Global Research and Innovation Forum on Thursday and Friday. The virtual event brings together diverse COVID-19 research scientists, regulatory experts, funders, member states, policymakers and other experts. The forum includes scientific presentations and discussions that focuses on different areas of research. There's also keynote presentations and panel discussions on how research can help end this pandemic and prepare for future pandemics.
Just over 2 years ago, as the world was still coming to grips with the spread of this novel coronavirus, WHO did what only WHO can do. We brought scientists together from around the world to identify the most urgent priorities for research and development. It's incredible to think that at the time, there were just over 1,000 reported deaths in China and only 1 reported death in the rest of the world. 24 months later, and almost 6 million people have lost their lives. The COVID-19 pandemic is a global health crisis unlike any that any of us have experienced in our lifetimes. It's teaching us all many painful lessons. WHO and partners have maintained a network of global researchers and experts that have produced a global research roadmap to focus research efforts on COVID-19, debate research priorities, develop methods, and critically appraise emerging evidence. This effort involves hundreds of virtual scientific consultations with thousands of scientists around the world. These global research efforts have filled in many of the key knowledge gaps around COVID-19 identified in the roadmap, including the epidemiological behavior of the virus, supporting the development of safe and effective vaccines in record time, and evaluating potential therapeutics.
And Germany's health minister warned today that coronavirus pandemic isn't over yet, noting that the country is still seeing record infections and high numbers of deaths. The Robert Koch Institute, Germany's disease control agency, reported over 200,000 newly confirmed cases and 226 deaths in the past 24 hours. Officials say laboratory data suggests there may be a large number of undetected cases, and thus the health minister is saying we need to be careful not to think that the pandemic is over. Well, joining us right now to talk more about the situation there, Chelsea Delaney, Deutsche Welle correspondent, joining us from Berlin. Hi, Chelsea. Give us a sense of the situation. Has the Omicron wave finally peaked in Germany?
Well, it does appear to have peaked. The key indicator here, the 7-day incident rate, has been steadily falling over the past several days. Though Germany is still reporting around 200,000 new infections every day. And public health officials also continue to warn that this might not actually be fully reflective of the level of infections because testing facilities do remain stretched. Now, the big open question is this Omicron subvariant BA.2. It is on the rise, and researchers have indicated that it could be even more easily spreadable. So while we are seeing infections come down now, experts are warning that we could see that change quite quickly because of this subvariant. So it is a very fragile situation.
And Germany's health minister has been cautioning against lifting restrictions too quickly as well.
Well, there are a few reasons why Germany is not joining in the wave of countries lifting all restrictions just yet. One is that public health officials are worried about that BA.2 subvariant. The other is that Germany still has a large proportion of unvaccinated people. Particularly concerning is the amount of people in high-risk groups. So around 12% of people over the age of 60, for example, are unvaccinated. So the health minister, Karl Lauterbach, says that justifies this more cautious approach. Though I will note that Germany is easing restrictions, and they do plan to lift most of them by March 20th. What will remain in place are social distancing requirements and also requirements to wear masks indoors and on public transit.
And Chelsea, some German politicians have been pushing for a vaccine mandate for all adults. Is that likely to happen?
Well, the prospects for a vaccine mandate have definitely dimmed in recent months. Chancellor Olaf Scholz, as well as the health minister, Karl Lauterbach, continue to urge Parliament to pass a vaccine mandate. They say it's necessary because we will continue to see new variants. And particularly next autumn, next winter, we could find ourselves back in square one. So they say we need to introduce this vaccine mandate now so that people have time to get fully vaccinated before the fall and winter roll around again. But even within the governing coalition, particularly from the Free Democrats, there is pushback to this idea of a vaccine mandate. The parliament is expected to discuss the idea in a few weeks. They say they could have a decision by late March or early April. But for now, there are a lot of different proposals, none of which have really reached consensus.
Chelsea Delaney, many thanks. Deutsche Welle correspondent joining us there from Berlin. And Iceland will lift all remaining COVID-19 restrictions today. This includes a 200-person indoor gathering limit, restricted opening hours for bars, quarantine requirements for those infected with the virus. Willem Thorsen, Ireland's Minister of Health, confirmed the country will remove all restrictions from February 25, including lifting all border measures with no additional restrictions for unvaccinated travellers. Speaking at a government meeting Thursday, Thorsen said that we can truly rejoice at this turning point, but nonetheless, it's encouraging people to be careful, practice personal infection prevention measures, and not to interact with others if they notice any symptoms. We have more stories on our website, channeltv.com. There you can take a look and get a better understanding of the pandemic, plus other stories breaking, and of course, the situation of the Russian invasion at your fingertips. It's channeltv.com. And that's our program this evening. Thank you for watching. I'm Millicent Nwaka. Stay healthy.